There is more to wellness than physical health. Mental health is a state of successful performance of mental function, resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and to cope with challenges. Mental health is essential to personal well-being, family and interpersonal relationships, and the ability to contribute to community or society. Mental illness is a medical condition that disrupts a person's thinking, feeling, mood, ability to relate to others, and daily functioning. Just as diabetes is a disorder of the pancreas, mental illnesses are medical conditions that often result in a diminished capacity for coping with the ordinary demands of life. Here are some important facts about mental illness. Mental illnesses are not the result of personal weakness, lack of character, or poor upbringing. Mental illnesses are treatable. How common is mental illness? 1 in 4 adults, or approximately 61.5 million Americans, experience mental illness in a given year. 1 in 17, about 13.6 million, live with a serious mental illness such as schizophrenia, major depression, or bipolar disorder. Mental illnesses can affect persons of any age, income, race, religion, or culture. Mental illnesses affect both males and females. Mental illnesses are more common than cancer, diabetes, or heart disease. Mental illnesses often appear for the first time during adolescence and young adulthood. While they can occur at any age, the young and the old are especially vulnerable. The impact of mental illness. Individuals living with serious mental illness face an increased risk of having chronic medical conditions. Adults living with serious mental illness die on average 25 years earlier than other Americans. This is largely due to treatable medical conditions. Mood disorders such as depression are the third most common cause of hospitalization in the U.S. for youth and adults aged 18 to 44. Over 50% of students age 14 and older with a mental health condition who are served by special education drop out. 70% of youth in juvenile justice systems have at least one mental health condition, and at least 20% live with a severe mental illness. Approximately 6.7% of American adults, about 14.8 million people, live with major depression. Suicide is the 10th leading cause of death in the U.S., more common than homicide, and the 3rd leading cause of death for ages 15 to 24 years. More than 90% of those who die by suicide had one or more mental disorders. Although military members comprise less than 1% of the U.S. population, veterans represent 20% of suicides nationally. Each day, about 22 veterans die from suicide. Serious mental illness costs America $193.2 billion in lost earnings per year. It is also important to know that persons with a mental illness have a higher prevalence of metabolic syndrome, liver diseases, hypertension, and dental disorders, have high rates of smoking, poor weight management, nutrition, and physical inactivity, have the lowest rate of utilization of preventive medicine and self-care. Stigma against people with mental illnesses can be oppressive and alienating and can cause people to feel ashamed. Stigma can prevent people from seeking help, denying them access to the support networks and treatment they need for recovery. Consumers of mental health services want to be listened to, treated with respect and dignity, and be recognized as a person, not a mental illness. You can make the difference. Treat people with mental illness with dignity and respect. It's important to respect the rights of people with mental illnesses. Similar to other people with disabilities, people with mental health needs are protected under federal and state laws. One more thing you can do. Learn the facts about mental illness and share them with others, especially if you hear something that is untrue.